Okay, good morning, everyone. It's Tuesday the 1st. I hope everyone's had a really good bank holiday weekend. So I'm going to provide you some updates, and we're going to talk about flu this morning. So if you've got any questions or anything you want to ask, just let me know. So the first thing I wanted to talk to you about was, again, ultrasounds. I know this has come up quite a lot recently, but I just wanted to give you another quick update about this. So I mentioned this on Friday that Rule 3 is now going to be accepting urgent ultrasound scans, and I just wanted to share what's been agreed as of Friday evening. So I'm going to share my screen so you can actually see the two forms that are coming out this morning to GP practices. So there'll be the non-urgent form, which hopefully you can see on my screen now. Sorry, this is the non-cancer urgent form. So what the Rule 3 have said is that they no longer be accepting TQuest ultrasound scans, as we already know, in the view of sort of getting back to business as usual and the backlog. But what they are doing is sending out this form. So this is a form that you need to complete for urgent requests, and this is being emailed out to practices today. So I'll share a copy of this so you can see it ahead of time. And although we probably are not going to be happy with this, I think it's something that's been agreed by NCL. Now, I think it's something we probably have to accept for the time being in order to sort of help the system recover. As we know, we've been doing forms for InHealth as well. And I'm going to secondly share another form with you, and this is for the suspected cancer that you can use. And again, these will be uploaded to Bar Global in the next day or so. So I just want to share this with you. I'm just going to share the first part of the document, which is the actual form. So this will be an urgent form that we need to fill in for suspected cancer. And I think what's important here is I'm going to just take you to this section here. This talks about the fact that we can access ultrasounds of the abdomen. We can also access MRI or CT of the brain if an MRI is contraindicated. So we can access CT abdomen for suspected pancreatic cancer, and we can do also an urgent chest X-ray on this form. So we'll need to reconfigure how we're doing X-rays now, chest X-rays in particular, and pelvic ultrasounds and testicular ultrasound. This is just for the Rule 3. There's a Rule 3 and Barnet Hospital and Chase Farm. And then, you know, it's a bit like a 2-week wait. You've discussed with the patient this is an urgent scan. It's the usual tick boxes that you will have to fill in. So again, these will be shared and some comms will be sent out by NCL today. I did want to show you this table because I think it's quite an important table. And again, I'll share these documents with you at the end of the presentation in the chat bar. About where you can get different types of scans, and this is for over 18. So certainly there's been questions about where can I get a DEXA. So you can get an urgent DEXA at the Rule 3, but you can get routine ones, for example, at InHealth or Whittington. As you know, Stanmore hasn't quite opened for that. So this is quite a good summary of where you can get what types of scans in the system. And as you know, InHealth don't do urgent or cancer or non-cancer urgent at all, but the rest of the hospitals do. So the Rule 3 will accept those using the forms. Just to let you know that although this is a Rule 3 form, North Middlesex, Whittington and the UCLH will be using the same form going forward in the next couple of days, so that it's NCL centralised. And I think what's important for us to know is that Rule 3 have agreed that they will accept ultrasound requests for those under the age of 18, whether they're urgent or routine, because InHealth does not do those scans. I think that's important. The next thing I wanted to talk to you very quickly was about febrile children, because that's going to be starting to be an issue as children go back to school this week, and not everything will be COVID. So we're being asked to categorise children into red, amber and green when we're reviewing febrile children. And so red patients would have red flags, and we're going to be sending them to a paediatric A&E. So currently that would be our closest in this area would be Barnet for the north of the borough, or Whittington. As you may know, the Rule 3 A&E is closing for paediatrics, or has closed, and I mentioned that in my webinar on Friday. And then green would be somewhere where you think there's no red flags. You probably think it's too early to say what the fever is, and you just reassure safety net. The amber is where we're not sure about why this child has a fever. And then we need to think about, are we going to see that child in primary care with appropriate PPE? If we're thinking they've got COVID, certainly we're really thinking about COVID if they've had a confirmed family case who's currently isolating, or the school has got an outbreak or something like that, then should we be sending them for an assessment at the COVID-19 hot hub? As you know, Edgware still is open, but we're moving to an NCR model, so that will soon be sort of NCR wide rather than borough wide. And to help us understand what to do with the amber patients, there are 2 webinars I wanted to mention coming up: managing a febrile child remotely during COVID. One is on the 16th of September from 1 to 2, and there's also one on childhood wheeze on the 14th of October. So I'll share the links for that again at the end of the webinar. The main thing I wanted to talk about this morning was about flus, and as you know, we're now starting to prepare ourselves for flu vaccines. So I think we really need to be starting to plan, or have already planned, how we're going to be delivering flu vaccines in the borough or through practices. And certainly, as you might have seen in the news on the weekend, the government is saying, well, if primary care feel they don't have the workforce to deliver it, we're going to be asking physios and paramedics. Now, of course, to us as small businesses, we need to make sure that we are protecting ourselves and making sure that we're able to deliver those. So things to think about now. Now, I'm just going to give you some ideas about what other people have been saying they're going to be doing. So one of the things is to send letters to patients with barcodes, so that they bring barcodes to appointments or slips to appointments, where you're doing an outdoor model and you wouldn't have IT equipment. Other GPs are talking about whether actually I've got a road where there's 100 frail and elderly people who are possibly still shielding or not leaving the house. Will it be quicker for us to go on that road and do a mass vaccination door to door? And then asking residents to come and wait at their front door. That's an option. Some GPs have talked about joining forces with the pharmacist and thinking about whether they can do that collectively. Whether we could do drive-through facilities if our practice car parks suffice, or whether we've got other car parks that we can use. Bearing in mind, I mentioned to you 2 weeks ago that if you are using a non-practice car park, you'll need to do a form with the CQC to make sure you register that as a site. Now, what's really important is that we start thinking about how we're going to make this efficient and cost efficient to us, bearing in mind we've got an extra £1, £1.20 per flu jab. And so are we having a clinical lead for the practice, or the PCN who's taking responsibility for delivering this? Are there any regulations or anything or requirements we need to do for CQC? And then what's the best setting? So if you had, for example, an outdoor model, do you need a fast track lane or a fast track queue? So let's say you had 3 lanes because you've got 3 clinicians doing vaccinations. Should whoever you think the fastest clinician at vaccination, should that be the fast track? So if somebody who's more vulnerable or frail or less mobility, should they go to the fast track queue? That can put pressure on that clinician, so it's something to be aware of. And then we're also talking about what's the right PPE. Now, although Public Health England haven't said to us, what we now know is that a single-use mask for a session and a visor should be adequate, but gloves should be changed between patients as per aprons, if aprons are sort of a tricky area, but certainly gloves. Now, however, there is a discussion about whether if you're using hand gel with gloves on, that might be adequate. So I think these are all really key considerations, and the recommendation is to generally change gloves, and I think that's something you need to bear in mind when we're organising clinics. Do we have waste disposal for general and sharps outside? Do we have a rest area or a welfare area? Do we have sort of a red bag area in case somebody was to have a collapse or faint in that zone, making sure that we've got somewhere for that person to sit? Or in the worst case, do we have an area where we might have to perform resuscitation or any type of diagnostics? So should we have a red bag? Are we really thinking about how we're going to be having the flow of patients? So is there an entrance and a separate exit, or a clear marked out area? Is there an area for queuing and maximising social distancing? Are there any facilities for our staff to hand wash or use hand sanitizer? And really, are we maintaining the cold chain? And I think that's really important, because if we're going to go outside and vaccinate, it may be that it's in our own car park, we need to bring out the vaccines in drips and drabs to make sure that we're maintaining the cold chain, because that's really key here, because you can keep those vaccines out for maybe half an hour or something, but really after that we start to lose the cold chain, and then we need to think about bringing those vaccines out in drips and drabs, or do we have cooling facilities outside? I think I'm going to stop there because it's been 10 minutes, but I think these are all the key considerations that we need to be thinking about in the next couple of days. I've seen a couple of questions on the chat bar. So the forms are going on Bar Global. There is a current form on Bar Global which is slightly old and will be replaced with the new forms. And so you'll be able to access it. And as with Dexys and InHealth, there will be forms updated as well. Andrew's mentioned that gloves are not required and hand gel between patients is fine, and that's absolutely correct. Hand gelling between patients is fine. What they're also saying is if you wore gloves and they're gelled on top of the gloves, that might be appropriate, although the gloves might start to wear down and may not be a good idea. Or you can decide to change gloves between patients. I think there's no wrong and right for that, but certainly what we do know is confirmed is that the masks and the visors per session are adequate, and you don't need to change those between patients, and you can wear one for the whole session. And I think that's absolutely the key factor there for that. Okay, so I'm going to stop there for this morning. If anyone's got any questions, pop them in the chat bar. Otherwise, I will see you all on Friday for another update, and I'll see you then.
Thank you.
Thanks, everyone. Have a